If you're dealing with low back pain, here's what's most likely happening and what actually helps. There's a lot of noise out there, and most of it is either scares you towards surgery or tells you to rest it out. Both are wrong. Your lumbar spine has 5 vertebrae, shock-absorbing discs, small facet joints, and a network of nerves and muscles. When any of those get overloaded or compressed, you feel it. The big myth: lower back pain does not mean something is permanently broken. Disc bulges show up on scans in people with zero pain all the time. Context matters more than image, and rest is not the answer. Guided movement always beats bed rest. It usually comes down to a mismatch. You sit at a desk all week, then play pickleball on Saturday. Your spine was not conditioned for that demand. Add tight hip flexors, a compressed disc, or a weak core, and that is your flare-up. Then pain makes you stop moving. The muscles guard and get fatigued. You move even less. That is how acute pain becomes chronic. It is rarely one injury. It is building up faster than your body can recover. At Carpe Diem Chiropractic, we start listening. When did it start? What makes it worse? Is it staying local or traveling down the leg? From there, we run a full physical and neurological exam to identify exactly what structure is involved. We also screen for red flags before anything else: loss of bladder or bowel movements, control, fever with back pain, pain after major trauma, rapidly progressing leg weakness. Those need urgent medical care, and we will always refer if that is the case. For most patients, none of those apply and we get to work. We use 4 phases. Phase 1 calms the irritation through spinal manipulation, soft tissue therapies, and nerve-specific techniques. Phase 2 restores motion with stretching, hip and hamstring mobility work, and dry needling for persistent trigger points. Phase 3 rebuilds capacity with lumbar stabilization, hip strengthening, and core endurance, because reducing pain is not the same as fixing the problem. Phase 4 returns you to your life with a sport or activity specific plan designed specifically for you and a home program built to last. When the clinical picture calls for it, we bring in additional tools: spinal decompression for disc herniations and nerve compression, shockwave therapy for chronic muscular pain, spasms, or tightness that has not responded to manual care, low-level laser and PEMF to support a tissue healing in both acute and persistent cases. We use these because your exam warrants it, not because they look impressive. For example, a 42-year-old desk worker came in with 3 months of right-sided low back pain radiating into the thigh. Pain was about 6 to 8 out of 10. He had stopped running completely. After 8 weeks, combining chiropractic care, decompression, dry needling, and progressive exercise, pain dropped to a 1 out of 10. The radiating symptoms resolved by week 4. Back to playing pickleball, back to running, and sitting through a full workday without an issue. That is what addressing the root cause looks like. We offer a complimentary consultation at our Fort Lauderdale or Plantation offices and locations. Download the free lower back pain guide and call us at 954-368-5483. At Carpe Diem will help you seize the day, not your back.